Assalamualaikum. My name is Muhammad Syafiq bin Rashid. My team has chosen a problem on limited health resources. Healthcare resources defined as all materials, personnel, facilities, fund and anything else that can be used for providing healthcare services. A lack of resources in healthcare setting has serious effect for the quality of patient care and the professional work environment for staff in the health sector. Having a good health resources available can make better conditions for the country to manage their health care. There are 3 examples of lack resources in healthcare that is include first, not having proper system for the documentation and treatment. Second is on technology issues, and lastly, short supply of medical equipment.
The first factor of limited research for health is human research availability. The availability of human research for health is one of the most pressing issues facing health system today, and it emerged as a key factor driving research accumulation and equity in Ghana. Policymakers strongly emphasized that they could not allocate resources to areas where they will indicate personnel to turn test research into programming that serves for the benefit of the people. However, there were differing views regarding whether this should affect the way in which funds are allocated. While all the health managers at district level acknowledged that human research is a major issue, they did not see that as a justifiable reason for not getting a fair share of the available funds. The second factor is local capacity to utilize funds. The capacity of local health managers to utilize funds efficiently is one of the crucial factors underpinning research accumulation. While this is closely linked to the availability of human research for health, there were districts with a good number of personnel but would lack the technical capacity to utilize funds more efficiently. Participants at national level expressed that although they saw the need to shift more resources to deprived areas in order to address existing inequities, they were unable to do so due to the limited capacity to utilize funds more efficiently in some districts. Although no residual balance was found from the financial statement obtained from district health administrations, several managers acknowledged that they sometimes have a residual balance at the end of the years. However, most of them did not accept the fact that they lacked the capacity of utilizing funds efficiently. The third factor is commitment to promote equity. Accumulation of healthcare research to promote equity is a political decision. The degree of political commitment to shift resources in line with established policy strategies was illustrated in the interviews as an important factor influencing research allocation and equity in the Ghanaian health sector. This was brought strongly to the fore when participants talked about the government's investment in big hospitals, while primary health care strategies such as the Community-Based Health Planning Strategy (CHPS) remain significantly underfunded. The influence of politics on research allocation was seen by some participants as something encouraged by the various interest groups and communities, who put pressure on politicians to deviate from policy objectives and invest in hospitals rather than in small clinics or health posts.
For the effect of this problem can divide into the economic effect and social effect. For economic effect can give an impact on the economy of some country who have this problem, such as give impact to the labor resources. The lack of medical resources will cause the country economy to collapse slowly due to the shortage of labor resources that take a long time to recover from some disease, specifically in the veterinary industry, which require a lot of labor resources. Furthermore, lack of health resources such as the problem preparation of medicine in the hospital or clinic, which cause the patient to need to waiting for a long time to treat a disease. As happened in Malaysia in 2017, the problem of medicine preparation due to manufacturing problem and will impact to the patient will take long time to recover from some disease. So the veterinary industry is unable to produce high production due to shortage of labor resources caused by this problem. This main problem also give an impact on the social in some country. For example, I choose Malaysia. According to the Malaysia Insider, in Malaysia, shortage of employing in the health sector which gives some impact on the society or patient because the number of patients is increased day by day. Although the budget presentation 2016 was present where the allocation of the health sector is to 3.3 billion by the government to implement several steps such as the construction of hospital, clinic and detail clinic. However, the ratio of patient is greater than medical doctor and nurse in Malaysia. In addition, Malaysia has estimated population has 34 million by 220. Therefore, the problem will cause some patients not to receive treatment properly due to lack of employees in the health sector to manage all patients at the same time.
However, there are some solutions for this limited resources problem. First, focus on improving the quality of health system delivery by elected leaders and healthcare personnel coordinating at various levels of healthcare systems in limited resource condition. Second, delegating tasks so that the medical staff will feel more responsible for their jobs. Third, those who are involved in making health systems work must be held accountable to the individuals and local communities. Fourth, increase in spending on secondary care services like mental health. Fifth, available resources should be allocated to improve the efficiency of healthcare system. And sixth, investment in research and new technologies to improve the quality of the care. In conclusion, every country should always improve their healthcare system to keep everyone able to live healthily, suitable with the third Sustainable Development Goals, good health and well-being. No matter that we are separated by different countries and race, we are still humans and we deserve to get healthcare, and we must stay united so no one is left behind.